From the lateral view in our overhead squat assessment, one of the common compensations is to see the client's arms falling forward. As we squat, we should be able to maintain our arms directly overhead or in line with our torso. So to set up for this, we'll begin by aligning the 5 kinetic chain checkpoints. Be sure the feet are positioned hip width apart and straight. Be sure the knees are in proper alignment. Be sure we have the neutral position in the hips. And then we'll reach both hands all the way overhead. All the way overhead. We notice that she already has a little bit of trouble getting them all the way up there, so there's a really good chance this may be a common compensation for her. Now we'll perform 3 to 5 squats down to the height of about a normal chair. So as soon as you're ready, we'll lower down and we'll immediately start to notice. Can you go any lower in that squat? We'll immediately start to notice how those arms fall forward, and we'll just do one more. And stand all the way up and stop right there. So notice here in her ending position, see how much further her arms have come forward. So we can see there she's not maintaining them way back where that starting position was. So her common compensation here is the arms falling forward. Now for our overactive muscles, if you could turn and face there, our overactive muscles are going to be the pecs. This would be both the pec major and the pec minor. The pec minor is going to run right here in the shoulder from the coracoid process down to ribs 3, 4, and 5, which is in an angle towards the midline of the body. And then the pec major runs that way as well. Whenever these become overactive, that basically means they're mechanically shortened and they're going to pull that shoulder into this forward position. When that happens, she's not able to maintain her hands all the way up above her head. In addition to that, the latissimus dorsi can also become overactive. So we'll do one more little turn here. We have the latissimus dorsi that's overactive. And now the lat runs from the anterior portion of the shoulder, runs right through here and attaches or clips the inferior angle of the scapula down into the spine and attaches to part of the hips. So if we go ahead and raise up here, what we can see, if that lat is shortened, she has a really tough time getting her arm into full shoulder flexion. And what we can really see in her, notice the position here of her back, and as she reaches up, we can see how that position changes, so it tells us the lats are probably short and overactive. Now for our underactive, the muscles that are not doing their job, they're going to be positioned here in the back. So we'll rotate again. So what we really see being underactive whenever the arms fall forward is the mid and lower traps. Now these are 2 muscles that attach here to the scapula and they run down at an angle towards the spine. What they really assist with is stabilizing and controlling the motion here of the scapula. So if we ask her to take her hand here to the side, slowly begin to reach up, we can see that the scapula here is supposed to rotate. The mid and lower traps help to control that motion. If they're not able to stabilize the scapula in that position, then we'll see that those arms fall forward. You can go ahead and relax there and turn and face. So in the lateral view, one of the common compensations we see is the arms fall forward. The overactive muscles in that movement compensation is going to be the pec major, the pec minor, and the latissimus dorsi. The underactive muscles are going to be the mid and lower traps, as well as the rhomboids that sit there in between the shoulder blades and assist with that stabilization.